I'd like to introduce you all to Dr. Shahzadi Harper. Dr. Harper is very well respected in the world of women's health, specialising in menopause, hormones in midlife, but in various disorders in younger women too. Shahzadi, thank you so much for chatting today. I'm sure you can explain much better what you do.
Oh, thanks a lot, Panda. Yes, I now run my own women's wellbeing clinic, really sort of focusing on hormonal health and wellbeing and optimizing women's health and having a very proactive approach, rather than waiting for things to happen, to sort of be more proactive and be prepared. And, hormones are a huge part of a woman's life journey, from puberty and beyond, and they impact us at every stage, periods, PMS, Polycystic Ovarian Syndrome, then we're thinking about pregnancy and fertility, and then we have perimenopause, menopause and postmenopause. And I think, whilst maybe a lot of it might have been covered quite well in the past, I think that sort of midlife journey, hormonal journey for women sometimes has been left a little bit grey. Yeah. And I'm here to put that sparkle back.
Brilliant. So can you explain, maybe everyone knows and it's just me that doesn't, but anyway, can you explain what it means when you are perimenopausal and then actually menopausal?
Yeah, so I'll sort of work it backwards, because I think you're right, probably everybody's heard of menopause, but I'm not convinced that they've heard of perimenopause. And menopause is that time in a woman's life when it's the end of her reproductive life, so her periods have actually stopped. And you say that you've gone through the menopause when you've had a year without your period. So it's what we call a retrospective diagnosis. And on average, for most women, that occurs around the age of 50, 51 years of age. And the perimenopause is that time leading up to it. When women experience symptoms like, I think typically people are more aware of sort of hot flushes, mood swings. And actually that can last for 4 to 10 years. So that can start in your early 40s. And women aren't so aware that these changes that are going on in their bodies, in their mind, in their brain are actually due to hormonal changes, rather than, whereas maybe they are more aware when they are getting things like hot flushes, that sort of irritability, sort of the typical narrative that maybe we see in the press and the media. So perimenopause, I think, is almost more important than menopause, because that's when it really impacts a woman's life, or it's starting to impact, and she may be in that sort of sandwich generation, what we say, in the sense of having children, they may be at school, going to university, but also having elderly parents that she's also looking after, and her own career and her own well-being. And, I think typically women do put themselves often at the bottom of the priority list, and maybe this is the time that they need to sort of raise themselves up the list a little bit more.
Yes, yeah. And does every woman get symptoms when they start, either of the processes, or can some women just sail through it without even noticing?
Yeah, so every woman obviously goes through menopause, irrespective of if she has children or not. Most women, sort of 75 to 80% of women do get symptoms, and about 20 to 25% will probably sail through, or what we think sail through. I mean, I'd say that they probably have lesser symptoms and lesser impactful symptoms, and probably, they're the kind of women who can have that sort of luxury of, if they're missing out on the sleep at night, they catch up in the daytime. So I think whilst we might say that 20 to 25% of women sail through, I think it's more about the fact it's less impactful on their life.
Okay, all right. And so what would be one of the main indicators that one is starting? I don't actually know whether I'm asking you whether they're starting to be perimenopausal or menopausal, but
I think an easier way of saying it sometimes is the menopause transition.
Yes.
So perimenopause to menopause.
Yeah.
And there are about 34 symptoms of, sort of perimenopause and menopause.
Wow.
And one of the first things that you may start to notice is that your periods have changed a little bit. They might not be so obvious, but usually a woman's cycle is about sort of 28 to 32 days. And it may just shorten a little bit. And this is what we call early perimenopause, when it goes down to maybe 26 24 days. Women pick that up when they've suddenly had 2 periods in a month,
Right.
whereas before it would only be 1 a month. So usually the cycle shortens a little bit. Other symptoms that start to happen around this time, which they may not equate to hormonal changes, are things like feeling fatigued, tired, feeling anxiety, feeling a bit more overwhelmed, not coping as well. And, they may just put that down to life, but that's also hormonal changes impacting them as well, because, the hormones don't just affect our ovaries, they affect every system within our body. So I would say initially maybe periods changing, then you may miss the odd period, they can become heavy, they can become light, and also those sort of psychological and mental health symptoms are very much more prevalent than people might think. And often women think that they may be depressed and they go and see their GP, and maybe they may even be prescribed antidepressants. But these are hormonal changes that are starting to happen at this point, yes.
Yeah. And how can you help women have a smoother passage through this change?
So one of the things I say is, first of all, if you don't feel like yourself, or if you're not feeling like who you usually are, so a lot of women say, I just don't feel like me anymore. I've lost my identity, and my skin looks older, my hair looks thinner. It's just I'm gaining weight. I've lost interest in sex. So if you're not feeling like yourself and you're feeling maybe more anxious, feeling that your coping skills aren't there, I would say go and seek help a little bit sooner. So, part of it is just being heard, being listened to. Often women walk out of my clinic just feeling empowered because they've got that knowledge on board. They don't necessarily have to walk away with a prescription, but it's about combining all aspects of sort of holistic well-being as well as medical health. Look at your diet. Are you drinking a bit too much alcohol? Because often women may use that as a crutch for anxiety, to help them sleep. Looking at all the other lifestyle factors. I mean, are they exercising? What's going on in their sort of personal and social lives? Are there things that they can do to help stress manage? So, I look at all of those strands of their life, and, if needs be, signpost them to the right supplements, what might be needed for them. Around this time, because of women's periods changing, and they may have heavy periods, they may be anemic, they may be iron deficient. That also causes them to feel tired, palpitations, anxiety. Women in their 40s, also a lot of women may develop an underactive thyroid. Typically that also sort of mimics symptoms of perimenopause. Again, things like vitamin D deficiency, we're talking a lot about vitamin D, especially in the winter months, but also in relation to COVID and how it helps with the immunity as well. So, I think women often underestimate vitamin D deficiency, and a lot of us are much more plant-based. So you may also be vitamin B12 deficient. So there may be nutritional deficiencies going alongside hormonal changes. So, one of the things is to almost like to have an MOT and think, well, where can we correct those? And then is there a need for HRT right now? Or is it something that we monitor, we see how you get on? But yeah, hormone replacement therapy isn't the sort of the devil that people maybe have thought of it as being. So yes, I mean, I may have a discussion with them with regards to that and prescribe it.
And how, so in simple terms as possible, how can HRT help?
So HRT is basically what it says on the tin. It's hormone replacement therapy. And your ovaries at this point in time are no longer producing those amounts of hormones that they used to, pre-menopause, when you were feeling good. So it's basically a top-up.
Yeah.
It's a top-up on what your ovaries were producing. So I often describe it a bit like a hormone deficiency state or an underactive ovary state. Just like if you had an underactive thyroid, you may take thyroxine and medication to top up your thyroid function. And hormone replacement therapy is giving you the additional hormones that your ovaries are no longer producing to top you up effectively.
And it generally then makes you sort of
yes, so because
more yourself, less tired, sort of.
So to think about it like this, I think often people think about our female hormones just as ovaries, but the estrogen, so our female hormones are estrogen and progesterone. Estrogen tends to be the hormone that gives us our sort of energy, our memory. And if you think back to when you're mid-cycle and ovulating, usually that's when women feel their best. And we have estrogen receptors all over our bodies. So giving back estrogen, you know, if you were experiencing things like joint pains, memory loss, anxiety, hot flushes, not sleeping, yes, it'll help to reduce those symptoms.
Okay. And I mean, so do you sometimes recommend some women start taking HRT before they are menopausal? Or, I mean, do you do blood tests and things?
Yes, so I do blood tests,
levels, everything.
but yeah, so I do blood tests, but it's a combination of the blood tests and your symptoms. So
yeah,
the thing I think one of the myths to kind of almost sort of throw out to get rid of is the fact that I think a lot of women think they must stop their periods before they start onto HRT. But as I've talked about before, it's at perimenopause time when you start to get these symptoms. So you don't need to wait for your periods to end. And the National Institute of Clinical Excellence very much talks about if a woman is over the age of 45 and has symptoms, she doesn't even need to have a blood test to be prescribed HRT. But I do tend to do it because I think it's good to know where the baseline is. I think it's good for the woman to be informed. And also it's good for us then to use as a baseline for when we monitor treatment. So yes, you can start HRT, you know, from your mid-40s onwards, or even sometimes a bit earlier, because 5% of women do go through a natural early menopause under the age of 45. And yes, you don't have to wait for when your periods stop. You know, I would almost say, you know, start earlier when those symptoms are impacting you. Why wait to fall off that cliff of menopause when we can do something beforehand? Because a lot of women, you know, start to feel that they really lose themselves by that point in time. And one of the things I do hear quite often is things like, you know, when they've gone on to treatment, they've said, I think I must have been miserable for 5 years or so. I think I must have been angry for 5 years. I can't believe that just adding back some hormone can make such a difference. And just remember, it's not just a woman that's affected. It's her partner, it's her children, it's her relationships around her. And I've often had sort of partners and husbands come on the phone, or because I do a lot of online consultations at the moment, you know, come on the Zoom and say thank you to me, because it's just made life much, you know, sort of calmer at home.
Maybe I think I need to come and see you sooner rather than later.
Yeah.
Oh dear. Are there common mistakes that you see women make in their management of the menopause? Maybe it's just not doing anything about it.
Yes, exactly that. I think that they think that they think, well, this is a natural process, so why should I be going to have treatment? And then because there's so many negativities in the press about it, and particularly things like breast cancer, when you hear scare stories that breast cancer causes HRT, HRT causes breast cancer. But you know, I think that's because in the past there were not so friendly HRTs, and also the studies that were done in the past were done on much older women. When we talk about the Million Women studies and the Women's Health Initiative studies in 2001, 2002, these were studies done on 63-year-old women on average, whereas we now know there's this what we call the timing hypothesis and window of opportunity. So starting HRT under the age of 60 or within 10 years of your menopause can actually give you positive effects. And also something like breast cancer, 1 in 8 women do get breast cancer in their lifetime. But the biggest factors for breast cancer are things like age, being a woman, and, you know, there are sort of risk factors like obesity, you know, drinking more than 2 glasses of wine per night, you know, smoking, which are greater than the risk of HRT. So I think I very much have this, let's put the risks into perspective for each individual woman, and it's not a one size fits all. Okay. So I think going back to what you said, I think often women don't do anything about it because they don't know enough about it, and then they just suffer. And I often say, you shouldn't be suffering in silence. You shouldn't have to put up with this. At least come and have a conversation and then make a joint decision around it.
Yeah. And I was actually going to go on to say, are there any downsides of HRT?
So the downsides are, if you start it, maybe, you know, I talked about, you know, the older that we get, I would say is baseline risk for everything in life increases. Our risk for heart disease, breast cancer. So, you know, I can never say that HRT doesn't cause anything, but what I can try and say is starting it at the right time actually could help with, you know, reducing your heart disease risk, reducing your dementia risk. You know, it helps improve osteoporosis, because 1 in 3 women get osteoporosis. And the thing to bear in mind, you know, more than breast cancer, is heart disease, cardiovascular disease is the biggest killer of women rather than breast cancer. So it's very much about, let's talk about each individual. You know, I very much tailor it to each person, you know, and everybody's risks are going to be different. If you are somebody who's drinking, smoking, overweight, then your risks are going to be far bigger, and we have to have a larger conversation around what's appropriate. And maybe the first things to tackle are those things rather than looking at HRT.
Yeah. And how long does one, so somebody comes to see you, I come and see you, how long does one need to be treated? I mean, obviously it's going to vary, but when does the menopause process finish? Once that's finished, do you stop I mean, I don't know.
So once your periods stop doesn't mean to say your symptoms stop. You know, by the time most women are at the age of 55, their own ovaries, if they weren't on HRT, are no longer producing estrogen and progesterone. So, you know, your risks, as I've said, about osteoporosis, heart disease, suddenly shoot up. So when people say, well, when do I stop? Often I might say, why would you want to stop?
Yeah.
Okay. It's not a question of you stay on the same dose throughout life.
No.
It may be that we, you know, tweak it and change it according to your own, you know, health changes, your own medical history changes. But really, you know, going back to the beginning when I talk about that, your ovaries are no longer active and we're giving you top up. And we know now that there are so many positive effects of HRT that women could benefit from, that I would almost say, why do you want to stop? What's the reason behind it? And let's have a conversation behind it. Because, yeah, I mean, I would say continue for as long as you continue forever, I would say.
Yes. Okay. Oh, that's interesting to know. And am I right in saying that a lot of women say they think when you're taking HRT, it makes you look better?
Yes. So one of the things is, you know, when I talked about estrogen receptors being everywhere, what happens is, you know, collagen, which is our scaffolding in our face, in our body, and also estrogen helps to produce sort of that plumpness and volume and skin. So, you know, when women go through menopause, they lose 30% of collagen. So that's why we tend to get that sort of hollowed, sort of everything seems to sag and drop, you know, let's put it bluntly. That's what happens.
Yeah.
And also the skin becomes thinner, it becomes drier, it becomes more wrinkled. And so, yes, you know, maintaining estrogen helps to maintain that sort of skin's plumpness, thickness, glow, luminosity. Definitely. It does help with all aspects of our body and our face and our skin. But that's not the only reason to go onto it.
No,
you know, I just want to say that that's not the only reason, but it is a plus.
And do you help women with their other aspects like their diet, you know, nutritional sort of advice?
Very much so, and also about their weight. You know, looking at nutrition, looking at how we can manage their weight, because you know, weight is such a huge part. And you know, we talk about, you mentioned about skin and looking good, especially for a woman, her visuals, you know, the way she looks really impacts her self-esteem and confidence, and especially in this visual world that we live in. So yes, it's very important to look at the other aspects, look at weight. How can we manage that weight? Are there things that we can do? Some, you know, from a nutrition, diet point of view. May she need a little bit of helping hand from a medical point of view, you know, just to maybe some medical treatment. There are lots of weight loss drugs out there that maybe just for a couple of months, just to get her over that hump, to get that motivation going. Even looking at skincare, looking at sort of medical grade skincare, because, you know, sometimes people have sort of freckles, age spots, lines, wrinkles, you know, helping her at this point to sort of look at what would be best for her skin, her hair and her weight. It's a very much a 360-degree approach. Yes,
it's the whole package, really, isn't it?
Yeah.
And is HRT treatment very expensive?
No, I mean, so one of the things is that I would say no, it's not. It can be prescribed on the NHS. So often, women, if they come and see me, they may then get their repeat prescriptions from their GP. The one hormone that we haven't sort of spoken about, and I haven't mentioned, is testosterone, because testosterone is almost like the third hormone that one can add in, and that helps with libido and metabolism, and that potentially is probably the most expensive part of the HRT when you buy it privately, because it might be difficult to get that on NHS.
Yes.
But then, let's put it into context. The tube costs about £100 to £120, and it lasts about 3 months.
Yeah.
So then we put it into perspective like that.
Yeah.
So, but no, on the whole, I wouldn't say it is that expensive.
No. And just want to finally ask you, you can help, obviously, the younger generation who might have problems with hormones, mood, I don't know. Can you just sort of...
Yeah, so I see a lot of younger women. I see a lot of younger women in their sort of early 20s with premenstrual stress syndrome, sort of how they helping them to sort of manage it. I think often when they go to their usual GP, they're just given a contraceptive pill and they're told to sort of go away and manage it. But it very much, again, is looking at sort of all the other aspects, and other women who've got polycystic ovarian syndrome as well, weight, hair, all of those aspects are really important. So I've got a group of sort of younger women in the early 20s that I do see, and I very much want to help them on their hormonal journey. I've in the past suffered with premenstrual stress, and I know how much it impacts on you on a monthly basis.
Yes.
And I don't see why younger women should have to go through that sort of, for 20 odd years of their life. And one woman said to me the other day, she said, I finally feel back to where I was before my periods ever started, and it feels so good to be there. Yeah. And I think, it is a multi-pronged approach. It's not just about sort of medication, it's also about listening, introducing sort of coping skills, management skills in there. So I think it's important for women to start to understand their hormones from an early point, and for them to be in control of their hormones rather than their hormones to be in control of them.
Do you deal with moody teenagers?
I think it's very difficult with moody teenagers. I think, there's an element that you can take away, but, their bodies, their brains, their hormones are all over the place. So I think, it's very difficult to sort of flatten out all of their moodiness.
Yes. No, of course it is. Shahzadi, thank you so much. That is really fascinating. I think everyone will find that really, really interesting. I think I'll be booking an appointment with you very soon.
You're welcome. I just really want to say to women, look, you don't suffer in silence, and you can be in control and take charge at this point in your life.
Yes, no, I think it's a really good thing to hear. Brilliant. Thank you so much.
Thank you.